The strategic partnerships that the Biological Threat Reduction Program has developed over time are vitally important. Everybody brings something different to the table. By combining the skill sets of these different organizations, that culmination of expertise and skills is what helps BTRP and the United States government mitigate the risk of especially dangerous pathogens around the world.
Outbreaks in other countries aren't really as far away as they look like on a map. The Biological Threat Reduction Program is aimed at improving our partner country ability to detect, diagnose, and report infectious disease events.
Partnerships are extremely important. Without having relationships, it would be impossible to get our work done. This is not something that the United States can do on its own.
We together with that country partner determine where the needs, the gaps are, and then develop a mutually established goal for working together.
Biosurveillance is studying the occurrence of diseases and the pathogens that are circulating to identify what those are. Sometimes it's perceived to be intelligence gathering because of the word surveillance, and who wants to have surveillance done? Biological agent surveillance.
The Biological Threat Reduction Program's provisioning of the laboratory sentinel stations in the various regions is important. Each region is dealing with different types of diseases that are endemic to the region.
The Electronic Integrated Disease Surveillance System is an information system that pulls together disease reporting data from human and animal laboratories.
Pathogens don't respect geographical boundaries. Tools like EADS, even if the country neighboring doesn't use it, it's able to connect. In Southeast Asia, Thailand is the first country that has accepted it and implemented it.
We can have the protocol for detection before it outbreak. It can be earlier detection.
The Pathogen Asset Control System is an inventory system, an electronic inventory system.
The PAC system is very important for the laboratory. The pool of the information in the same place, and it can use for tracking the sample.
We've been working for years to try to develop a common language and be a complete network that covers the globe.
We also provide training to do the epidemiology analysis to understand why is an outbreak happening, how to go about controlling that outbreak.
If a nation doesn't have a core of capable epidemiologists, it's going to be very difficult to detect. It's going to be very difficult to also analyze disease data. We call it the Field Epidemiology Training Program, or FETP. It's a program where we bring in professionals in the public health and veterinary health spheres to learn how to go out into the field, collect data, and study how a disease occurred, how it spread.
The expertise that Georgian scientists have acquired is not only used by us and kept by us, we are eager to share it to others. We are planning to keep on doing this in the future.
FETP graduates actually became mentors, so they are now deployed regionally, sometimes across the border into neighboring countries, including Ukraine.
The Biothreat Reduction Program is vital to Ukraine's continuation to modernize its health system, as well as to ensure that its scientists are well educated.
The major goal of this program to implement in this country evidence-based intervention. We want to teach professionals here to conduct research.
The level of laboratory equipment and safety that's being provided will directly impact and increase the biosurveillance and biosecurity of the country.
And we're really excited that we will have so modern and well-equipped laboratory constructed under the international standards.
This is going to improve diagnostic capacity. This is certainly a great milestone for our success and our friendship.
We together are trying not only to learn something, but also to change public health in this country to make a difference.
The Biological Threat Reduction Program is a cooperative program, first and foremost.
The program is, in a very apolitical way, introducing people and opening up the possibilities of working together.
We call it biological threat reduction, but it's really about collaborative biological engagement, building partnerships.